and then we want to just jump right in with the questions and to start talking about how we are faring in this pandemic now that we are surfing the surge of Omicron. Our first guest this evening is Dr. Patty Wilson. Dr. Patty Wilson is an assistant professor at the Johns Hopkins University School of Nursing. In her faculty role, she serves as a clinical coordinator for pre-licensure nursing students during their psychiatric clinical rotation. She also teaches in the Psychiatric Mental Health Nurse Practitioner Postmaster Certificate Program. For her faculty practice, Dr. Wilson is the site coordinator for doctoral nursing students working as community health nurses at the House of Ruth, Maryland, a shelter for individuals and families escaping intimate partner violence. Dr. Wilson is the co-principal investigator of the Passport to Freedom program, which provides psycho-educational sessions for women to promote self-awareness of the link between trauma and health, and offer strategies to cope with symptoms of trauma and stress. Dr. Wilson completed her doctoral in psychiatric mental health nurse practitioner studies at the University of Virginia School of Nursing. Her dissertation focused on the relationship between housing instability, race, ethnicity, depressive symptoms, and increased exposure to IPV among mothers. Dr. Wilson works as PMHNP at Families First Counseling and Psychiatric, a Baltimore City community-based behavioral health clinic. And she's also my dear soror. Welcome, Dr. Wilson.
Thank you. Thank you very much for allowing me to participate in the panel today. I'm very honored to be a guest, and I look forward to sharing my experiences with working with clients who during this pandemic. So thank you very much. So
grateful to have your wisdom and knowledge. Thank you so much, Dr. Wilson. And our second guest this evening needs no introduction. We all know he's dearly beloved by us all, Dr. Panagis Galiatsatos. Dr. Galiatsatos is an assistant professor at the Johns Hopkins School of Medicine in the Division of Pulmonary and Critical Care Medicine. He has been on the front lines of this pandemic since day one, and his wisdom and his knowledge have become highly valued in this whole conversation of working our way through the pandemic safely. And he is known for giving accessible information in a timely manner. And he's also known for very bad dad jokes. Dr. Galiatsatos is the co-chair of the Johns Hopkins Health Equity Steering Committee, and he is the co-director and co-founder of the novel medical initiative, Medicine for the Greater Good. He has published over 40 research articles with a focus on health equity, community engagement, and contextual level variables impact on health outcomes. During the pandemic, Dr. Galiatsatos and colleagues coordinate community engagement to assure all populations were able to access COVID-19 updates and resources in an effort to assure compliance with public health requests. Thank you so much, Dr. Galiatsatos, for joining us this evening.
It's a true honor to be here amongst educators and so forth, and just excited to be able to get information into your hands tonight to help us with this pandemic. Thank you.
So grateful for both of you being here. And I will introduce myself again. My name is Annette Campbell Anderson, and I am the Deputy Director of the Johns Hopkins Center for Safe and Healthy Schools. I am also the faculty lead for the School Administration and Supervision program in the School of Education at Johns Hopkins University. So we've got a wide variety of people who have joined us here this evening. I want to thank all of you who've come from so many walks of life to listen in on this evening's conversation. And I want to jump right in. I'm going to start with you, Dr. Wilson. We know that we are still in what now as we thought would be a 2-week longer spring break, and now has turned into year 3 of this pandemic. And so I want to just kind of start by asking you, where are we right now in this pandemic? And let's talk a little bit about how the Omicron surge has perhaps affected some of the mental health of some of the people who may be on this call and some people who may not be. But we know that this pandemic continues to have an impact worldwide, not just on the physical and the physical health of people who have been affected by this, but also on the mental health of communities everywhere. So it's been a strain. We've had pandemic fatigue, and now we've had fatigue of the pandemic fatigue. So where are we in terms of the mental health pieces of the pandemic right now, Dr. Wilson?
I believe one of the biggest things is we're still making it through. It's been a very challenging time for all of us. And when I say all of us, I mean all of us, because this is something we've never lived through. We didn't go through things centuries ago. And so we're adapting each day. And so when it first occurred, I mean, as an educator myself for higher education, I know how difficult it was to transition from in-person to virtual. And this is like, you have to do all these things quickly. So this is for the students, for the parents, for the educational system. It's a lot of different changes. And for us to be able to have compassion, really to understand that this is going to be a shift. It has been a shift. And although it's been we have a little bit of time that we have adjusted, that it's not as the first year when we were completely on shutdown, that we have some resemblance of normalcy of being able to have maybe hybrid learning or maybe go to work at least once a week, depending on where you're working. So there is some shift, but we're having a hard time still adjusting to life. So one of the biggest challenges that we've had is just finding resources and having enough mental health support out there for us all. So it's been very overwhelming, to say the least.
And in our schools, we know that this has had a particular impact for our educators. Dr. Galiatsatos, can you give us a little bit more insight about how has Omicron really impacted the desire to try to keep schools open? We know that everyone has wanted to make sure that our students were our first priority in getting back into the classrooms last fall. And so that was able to happen mostly successfully across the country. But with the Omicron surge, what were you seeing in terms of patterns and how Omicron was playing out as a different variant in our schools and impacting instruction and learning?
No, it's a great question to ask because, when we first heard about COVID-19, during that early time, all we really knew was, hey, this spreads through the air. And it seems to have a high mortality rate in regards to the general population and healthcare utilization. And so we went with the most extreme intervention for any public health reaction to an infection, towards a contagious infection. We shut down. The reason why I bring that up is the way this pandemic looks to end, right? The ending of a pandemic doesn't mean COVID goes away. It means we've learned to kind of live with COVID, where there might be some inconveniences of life, but there's no massive disruptions. And one of the first arenas to kind of learn how to assimilate is you amazing educators, how to get our kids safely back into the schools, to learn in the classroom with these amazing teachers and help them. And so hopefully you all felt that a lot of attention was put onto that, how to do this safely. I mean, one of the things that we've said as colleagues, whenever we get invited to town halls, is the best way to not spread COVID in the schools is to not bring COVID into the schools. So that right off the bat means you got to have these active engagements with families, that they're doing the right thing to not catch COVID and doing the right thing to not, and then give kids COVID and have them come in with COVID. So that to me showcases that this pandemic, yes, we all say we're all in this together, but the really is one of those community places where we feel that more than anything else. And so, and speaking of school, sorry for the interruption.
I love it.
So I say all this because, we in this pandemic, right, keep in mind, and I don't think my colleague has copyrighted this, so I'm going to steal this. We are building the plane and flying it, right? None of us, Dr. Wilson and I are not grabbing our textbooks, turning to page 382 and be like, year 3 of the pandemic, this is what we do. All right, let's follow that. This is, for all of us, this is our first one. And so what we're learning in the real time is like, all right, how do you take a step forward And if we have to take a step back, how can we minimize that? And I say this because that's what Omicron taught us. When this virus created a whole new variant, right? Same species, still SARS-CoV-2, just a different variant of it, a genetic change, right? Just like your children, they're genetically different than you. This is it. It was a genetic change, and we gave it the potential to infect us with the holidays occurring and everything. This was a little bit more insidious because a lot of the prior symptoms that we discussed with the prior variants, they changed. It's no longer dry cough and shortness of breath. Now it's sore throat, runny nose, maybe a headache. So I say this because with the symptoms being non-specific, with the holidays occurring, with Omicron being as contagious as its genetic potential allows it to be, suddenly we saw a massive surge of it, a wave. And yeah, that resulted in us needing and necessitating to kind of take a step back with a lot of our schools, or at least to rethink, do we keep in, or do we see so much community surge and so many hospitalizations needing us to kind of take a quick step back? But what I love about where we're at with the pandemic, we know enough to say we know how to take good steps forward. And if we need to pause and take a step back, it's mitigated. It's not extensive or excessive as it was when the pandemic started. And that's going to be kind of the trial and error as we move forward of how to learn how to adapt with this, because we have the weapons right now. Science has them to end the pandemic, to make COVID nothing more than a non-life-threatening disease. We have those weapons. It's just how to strategically use them, from face masking to testing to vaccination, how to strategically use them so the communities can live without fear because of the science.
Thank you, Dr. G. I want to go back to you, Dr. Wilson. So, we are hearing from Dr. G that this has gone on for a while. It continues to mutate, and there continue to be lots of changes. And because of that, the role of educators in our schools and in our classrooms they've really had to be very adaptive this fall in particular, in how they've responded in order to keep schools and classrooms open and students learning. And so what you're seeing, for example, is principals, as epidemiologists and school nurses becoming contact tracers. And so all of this is changing the role of the adults in the building. And it's very different than how we have trained them in their preparation programs to be in the field. What do you think are some of the longer term impacts of having so much change to the roles and responsibilities professionally of these adults in the building? Because now we've asked them to take on public health roles that we've never expected our educators to have to do before.
Well, as a nurse, I'm going to advocate for us having more school nurses to be able to assist with some of those responsibilities, but to also be able to educate to have our educators be able to know the signs and symptoms of being able to know what to look out for. It is an adjustment, but I think in the long run, it's going to help us all by being able to pick up on those clues that will be able to keep us all safe, including themselves. So it's an additional role, but it's well worth it.
And we're seeing that so many of our educators are stressed out because of this. So there's a lot of stress that's happening in our schools because educators are taking on these additional roles. And so what kinds of signs should teachers be looking for in themselves and in their colleagues to be able to diagnose some of this stress and to be able to acknowledge that maybe they need to think about some different ways to remediate this?
Burnout. Workforce burnout is something that the World Health Organization had just mentioned as part of a diagnosis as well, because it's been happening so much regarding even prior to the pandemic. And so one of the things, again, is that self-awareness, to be able to know when you're feeling that you don't have the same passion that you had before. You may even start to have physical symptoms where you have upset stomach, GI issues, you may have headaches, you may have insomnia. A lot of times it's that your mind is racing because you're very stressed or have a lot of anxiety and you're thinking about all the things that you have to do. And so that can lead to poor sleep, and poor sleep can impact your life in so many different ways. And so it's really important to be able to tell the changes that are happening with yourself. Ideally, it would be great to have something where, again, with the school system itself, has things in place for our teachers, for our educators. If there's a crisis line, if there's some type of way for them to get counseling if needed, some type of support system so that they will have that opportunity to do self-care, because that in the long run is going to help with the educators to be able to continue with their role. Because I'm also seeing there's a lot of people that are burnt out or leaving the workforce.
Yes.
And so that's
Yes.
what we
Yes.
don't want. So it's really beneficial for the school system and a lot of different jobs to put in place these things to help with the burnout, to help to have things in place so that they can go to seek assistance so people will be able to continue with their jobs.
Awesome. Thank you, Dr. Wilson. I want to remind our audience that we would like to hear from you. Please ask your questions, put your questions in the Q&A. Please also, you can also text your questions to 22333 and type JHUWL in the message. Dr. G, I want to now turn to you as we start getting some of the questions from families and educators who are also on tonight's call. I want to ask you about the masks, because the masks seem to be so political. They seem to be the cause of so much trauma. We've seen, a big surge this month in the number of people who are now advocating for only KN95 and K95 masks. And then you see that some schools are saying, well, you've got a 5-minute or a 10-minute mask break. What are you seeing right now is best practice for students in schools around keeping their masks on or not? We're hearing from parents that it has become a source of bullying for some students if they are not having a mask on, or if they're in a school where there is a voluntary mask adoption. What is the best practice really around these masks, and how can parents and how can educators kind of cut through all the noise to try to figure out how to do what is safe, but also in a way that continues to support student engagement so that we are mitigating some of these other stressors that we're hearing about, even as we're hearing from educators that they have to have these mask breaks, for example?
Yeah, no, let's tackle it. But first I want to actually, Dr. Anderson, the question that you asked Dr. Wilson about
Yes.
kind of like these new roles that we came up with. The reason why I bring that up is it was the teachers, right? Remember, it was the teachers that created this. When a teacher emailed and said, kids all want to talk about COVID, can you guys come in? As I'm a teacher, I'm not a COVID expert. So I really want to applaud the teachers, because we're all here 2 years ago getting together with Dr. Anderson and others because you were our catalyst. So want to just put that out there. Thank you, teachers. Now let's go to the face masks. So even taking a step back, when you have a contagious disease, a contagious infection, first thing we do, how do you catch it? Is it a GI bug? Do we got to work on our sewage system and have food control? Is it a blood pathogen? Do we got to worry about how to not get blood exposure out there? Or is it airborne, like COVID? So the second we knew it needed the breath you breathe out to be breathed in by someone else. In the beginning of the pandemic, if you guys remember, we did everything. Face masks, and remember, this face masks were always emphasized, but in the beginning, just for symptomatic people, because we thought SARS-CoV-2 was going to be like its predecessor, SARS-CoV, only spread when you had symptoms. Then it throws that curveball, asymptomatic spread. Right, this is going back to what Dr. Anderson's always said throughout the pandemic, we're building and flying at the same time. I think a paraphrase, sorry about that. But the notion of the face mask has always been a recognized weapon against airborne viruses, even before the pandemic for us physicians and healthcare professionals. So in the beginning, symptomatic, wear a face mask. Then we realized there's asymptomatic spread. So we started saying, all right, everyone wear a face mask because you may have it and not know it. Right, so even the notion of science has evolved. But if you have an airborne virus, the best way to stop it is either just don't breathe in the air someone else is breathing out. So that means staying home or publicly distancing as much as you can, physically distancing. Or if you're going to engage, like going back into school, face masks work. They work. I mean, I say this because I trust mine when I'm with patients with COVID for about 12 hours. And sometimes it was the only barrier I had. And to date, I haven't caught COVID from my patients in the hospital. With that said, early on, with the earlier variances, the surgical mask, the cloth mask was sufficient enough, right? There were two different masks, but I'm just giving you those types. Just like me, when I go in and see patients and say they have influenza, flu, I could get away with that patient coughing with just my surgical mask. If that patient had a more contagious bug like tuberculosis, I'm going in with my N95s, pressed up against my skin, clean shaven, so my stubble's not creating even a single barrier. Omicron's changes resemble the contagiousness of something like tuberculosis. So yeah, Mother Nature threw us a curveball, and we had to step up. We had to adapt. And that's what the KN95's emphasis is. Not because we got it wrong from its predecessors. We had the right masks for the right variant. Now we need a new mask for this variant. And so that's the emphasis on putting it there. And I say this because we have to recognize, the bullying that comes along with it, it's frustrating, right? I agree with you, Dr. Anderson. The politicization of a face mask I say this because it's been my tool as a healthcare professional going and seeing my patients. I've never had a patient bully me was wearing a face mask. He or she knows I'm wearing it to not catch what they have or to not spread what I have and is very innocent for me to them. Like when I go see my patients with getting chemotherapy who don't have a single immune cell, they'll bully me to put on a face mask. They're like, what are you doing? Stay away. I don't have an immune system. Put on your mask. So it breaks my heart. In addition to that, and I know this is kind of now just sharing my opinion, I apologize, but in addition to that, there is a massive population of children with cystic fibrosis who've always worn a face mask. It's how to keep yourself safe. One of the local high schools here that we partnered with last year with our curriculum, they had a student pass away from CF. And so a lot of the students before even the pandemic were wearing face masks just in a manner of camaraderie with that student. Face masks are protective for so many of our populations, for so many jobs. This is not meant to be politicized. And I would say, the beautiful thing about teachers, you all know how to counter bullies. And so what I would say moving forward, maintain that grit and tenacity, recognize the science emphasizes this works. And I had a patient who came to me, he's like, I can't believe we're wearing masks. I'm like, I wear masks all the time, so I don't catch my patients out. They work. They've always worked. So if you need the science to be that shield, we are here for you to make that emphasize that. I recognize where we're at though, even with my emphasis that this shouldn't be politicized, at the same time it is. So what I would say is the teachers have always been our best examples of what a good person is. Use us to kind of reaffirm that. So we are here for you, but masks work. We may have to adapt depending on the variant, but they work.
Thank you. So I want to start jumping into some of these questions. We're getting a lot of questions, Doctors Wilson and Galiatsatos. So I want to jump in because I want to make sure we try to answer as many of these as we possibly can before our hour is up. The first is, how do we mitigate asymptomatic spread among students, teachers, and other school faculty right now? Because that seems to be one of the hot button questions that parents have, administrators have, and everyone seems to have a different response to this question. So Dr. G, we want to start with you with that.
Yeah.
What are some best practices around this?
Best practices, I'm going to give you 3. And I know it's kind of, right, like I said, we have the tools, just how do we approach one is actually what we're doing now. Like if schools, and I know this might be an extra leap for schools, but if schools can hold like a weekly or twice a month meeting with families to reemphasize appropriate practices for them out in their community, like maybe rethink having that 50-person childhood party in your house. Like because again, you're going to spread COVID into the schools if you bring COVID into the schools. So do what you can to communicate to the parents and bring doctors on, bring us to come and talk to them, right? Because the more you communicate with the families to not catch COVID, the best way to not bring it into the school. So the first one is communications with the communities that you serve and teach. The second one is vaccination. So the vaccines, I want to make it clear, when they came out to be studied, they were studied to prevent severe COVID. Meaning, can we provide you a vaccine that keeps COVID from being a life-threatening disease? And the vaccines prove just that. Again, not 100% effective. We're not God. We can't be 100% effective, but we are darn close. I feel like a teacher would still give us a good passing grade on it. We got the vaccine, and then we studied, all right, what are other great unintended consequences of it, right? Other benefits that we didn't study, but in the real world, let's see what happens. And one of those real world findings was the rates of asymptomatic spread in those who are vaccinated drops off significantly. Mm-hmm. What a great, now again, it means if I'm vaccinated, I can still spread COVID, but mainly when I'm symptomatic. So when I'm getting that sore throat and runny nose.
So how long does that last? I think that's the other thing. There's a lot of just misinformation around how long are you symptomatic? How long are you shedding the virus? People want to know that. And I think there's a lot of conflicting information right now about that.
Spot on, Dr. Anderson. And that's a great point. So then the second point. So say you catch it. And the last one I'll add to the first one, to the first. So the third one is masks. Trying to wear them as much as you can, especially during surges. I will say this, what I always tell schools, one of the first things you can start letting go of is testing, and then after that, masks when the surges drop. So when the surges go up, we adapt. When they come down, we can let go. But the mask is another key one. But then how long? You're right. If I am symptomatic and I'm vaccinated, how long does this last? Now, this is the part to try to walk a fine line of having science and at the same time trying to adapt to it in life. Like, for instance, science has taught us the number one way to get into a car accident is to be in cars. Right. You're going to say, well, I need to get to places. So I'm going to learn everything I can do to be safe when I drive so I don't get car accidents. Great. So we know when you can shed with prior variances. And now with Omicron, we realize that may be a little bit longer than its predecessors. This is now the devil of Omicron, meaning once I feel even better, unlike its deltas where, down to 30% contagious around day 5, Omicron likely lingers for a few more days. That's what our Japanese colleagues have shown us. So what I would say, and this is the tough part, and I get that, but what I would say is 3 things should align for someone to feel good about not being contagious. One is about 48 hours with no symptoms. Feel great, feel like myself. 2, definitely at least cross that 5th day mark. So hopefully those 2 things are aligning, 48 hours without symptoms and the 5th day level. And the third one, to give people peace of mind, is a good rapid test. The purpose of the rapid test is to show you're actively infected. So a negative one gets you the confidence that you're not actively shedding. And I see this because all the data around day 5, those are predecessors, those are prior variances.
Right.
So right now we're learning about it in real time. And I would say those 3 objectives, if you hit those 3, no symptoms 48 plus hours past day 5, and a negative test, to me, that gives me the confidence to say, come back into the real world.
Okay, that's very helpful. And I do appreciate that. So I want to make sure that we are getting to some of the mental health questions that are also popping up. So again, we're getting lots of great questions in the chat. I want to encourage people again to please drop your questions in the Q&A and also to text them to 22333 and type JHUWL into the text. They're getting the questions to me. Here's one for you, Dr. Wilson, and I think is really important. Do we have a sense yet of the impact that COVID and Omicron is having on our children's mental health right now? And also, do we feel like our young people are more resilient than we are as adults and that they are more adaptive right now in this pandemic at this point than we have been as adults? What's your sense?
Well, I can tell you what we've been seeing. We've been seeing a lot of both adults and children with anxiety around, of course, the changes around the pandemic of being exposed to, anxiety around the shift in how classes are now set up. There's a lot of depression, and a lot of the depression is coming from isolation, of not being able to have that social interaction with their peers that they're used to. So that really depends on the age group as well, because we talked about, developmentally, it's very challenging to engage younger kids on virtual learning when they're used to being able to do things in groups and being together. So that makes it challenging as well. So there's the isolation that comes into that can lead to depression, the anxiety around the pandemic itself, the anxiety that they're feeling from parents, the adjustment that's happening from them. And there's also irritability. So one of the ways that it is expressed is being angry, being upset, being irritable. So it's a little bit more than what you normally see from, I'm speaking about my teens, So yes, I have teens that can be moody, but this is to the extreme. So you may see them a lot more fights, arguments at home that you may see. You may see just the frustration a lot of times too, depending on the child being able to express their feelings. So if you're not able to verbally express your feelings, that may come out in different ways. And so that's where you get, the anger or the frustration and maybe being snappy. And what some of the teachers may have, I'm seeing this already, is that when they do go back to school, once they've been at home for a while, and it's might be maybe the mom, maybe the parents are there, maybe they're at work, we don't know the situation, but when they go back to school, there's a little bit maybe more structure, and they are not really ready for that change in the routine that they had before at home. So there's more defiance or more arguments, or the behavior may shift in the school setting as well. So those are the type of adjustments that you're seeing. One of the things also, of course, is if you're noticing that the child is more withdrawn, if you're noticing that they are sleeping a lot, that may be signs of depression, eating, overeating, undereating. Other things that children may do is cut themselves. So you want to check on places like their thighs and their arms, places that you can't see. So those are signs that you want to look for. And you want to make sure you're seeking help if needed in those situations, because people may become suicidal, and we of course don't want that to happen. And so you want to make sure that if they're having a hard time adjusting, that you're seeking assistance for them for that. The question about, are children more resilient than their parents are when it's dealing with the mental health? That really depends. I can say on some circumstances, yes, but if someone had a pre-existing mental health illness to begin with, and this is just exacerbated, I can't say, who is adjusting better in that case. So it's really individualized. But I would say for the most part, children are more resilient. But we also have to look at how the household is and the support system that's coming from that household. So the biggest thing, as I say to a lot of parents, teachers, same thing as when you're in the elevator, in the airplane, you want to put your oxygen on first and then put your oxygen on other people. So you want to make sure you're taking care of yourself. And then in that way, you'll be able to take care of others, the children, your children, or your students, because they can sense things with you as well. And it's a lot of stress dealing with all of this. So making sure that you seek help for yourself.
Thank you. Thank you. That's a great response. I mean, we're still getting lots of really great questions. I want to try to get to as many of these as I possibly can. Dr. G, I want to come back to you and talk about testing in schools. This is another hot button topic. How successful do you feel the testing in schools has been? I know there's a lot of different opinions about whether the testing has been successful, how many students have been tested, and what are the outcomes for students that are tested, and the close contacts and the quarantine requirements around that. That has also shifted over the fall in terms of it used to be 10 days. Now it's 5 days. And so we said 6 feet in September, and now we're down to 3 feet, no feet in February. So we are seeing that this notion of what it takes to be safe in school is also really shifting right now. So one of our participants asked about the testing and the variance and how the tests are given, to whom the tests are given, and the randomness of some of that. So what's your opinion about where we are with the testing programs and where the protocols that we have in place to keep kids in school right now?
Yeah, no, so this is a great question. And so I'll speak to it in kind of a broad scientific sense. One thing to keep in mind again, so remember in the beginning I said, hey, we got an airborne virus. Oh my goodness, it takes advantage of our social engagements. Close proximity, talking to one another, breathing in the air, I'm breathing out. So we locked down. We did the most severe thing any public health intervention could. And now we're trying to assimilate. But that might mean, saying, all right, let's keep everything in those schools. Testing, face masks, physical distance as much as we can. And then we realize, okay, a lot of that is really hard to do. Mm-hmm. And so I say this because I do still think I know we have the tools to end the pandemic, allowing us to assimilate. How to use those tools strategically, that's going to take a notion of what's happening in the community, in the hospitals, and what resources we can have. So right off the bat, before we go right into the test, I still want to emphasize the face masks by far are the most effective weapon to spreading the virus. I mean, this virus is airborne, so catch it as you're breathing it out and keep it from breathing it in. Then how to use the tests. So I do think the tests have a place at the schools in order to identify potential cases where maybe it's asymptomatic, or maybe it's a child who's like got a runny nose and you're like, this is okay, let's just test and make sure it's not COVID. Gosh darn it, it is COVID. Right? That's the concern with Omicron. It gives you these really non-specific, really kind of non-specific, I call them not just non-specific, but non-specific and dismissive symptoms. We've all had a runny nose, we've all had a sore throat. I've dismissed it. Its predecessors gave you a dry cough. It's hard to dismiss. Right? Coughing is like smoking in public. You're going to get attention and give you that shortness of breath. Omicron has changed that. Non-specific dismissive symptoms. So I think testing does have a place, because if you can identify someone with COVID, then great. With no judgment, no stigma, you remove that individual. Like, all right, whether it's a teacher or a child, get them to be quarantined at home until that goes away. Now, with that said, how to strategically use the tests. Again, when the cases in the community fall, I do think that testing becomes less significant, right? Because what you're doing is, if it's burning in the community, someone's probably bringing it into the school, right? You're rolling the dice, there's a higher probability. In the schools, what I really do think, depending on the test you have, I think really still the rapid ones are the most efficient ones for the schools. Now, it doesn't mean it's the better test. The PCR by far is the most sensitive. But PCR, the challenge I have whenever I talk to schools is like, oh, we'll send it to the lab and we get it back in 3 days. I'm like, well, that's 3 days later. How practical. So sometimes I will swap out practicality over the science. So I think rapids are reasonable to have in the schools, especially if you have a lot of vaccinated individuals. If they're vaccinated, then yeah, the rapid's the best test for them, because it's going to catch the contagious symptomatic version of the virus. The tests still work on Omicron. Good studies have come out to show, hey, Omicron is still picked up by the test. So peace of mind and confidence that the rapid test that exists is great for it. The PCR, by the way, will always be great for any coronavirus. It will pick up even the slightest hint of it. Rapid is still great. When to strategically use them, I would use them in the schools when the cases are really high in the community. So if they're high in the community, likely you're going to get some entering the schools. And then the last part I'll say about the test, when you want that child or that teacher to get out of isolating or quarantining, the rapid test is, again, the best one to use. Why I say this is because if you're going to do PCR, again, we spoke to a Jewish school in Montgomery County about this. They were using PCRs and keeping people out for weeks. I'm like, you got to understand, PCR is a contagious virus. It's just picking up anything from the virus. So it's like the equivalent of finding a boat in a graveyard. That's not a human being, that's a remnant. So PCRs will pick up dead virus. So if you want someone to come out of quarantining or isolating, the rapids by far is still the best tool. So I think tests have a place, and I would use them when you have a heightened amount of community prevalence that we have now. The light at the end of the tunnel is there. We're going to start seeing those cases come down. And one of the first things I say schools can kind of scale back on is testing for asymptomatic cases. I would probably keep the test for just symptomatic, and then you just use them more strategically. We have the tools. It's just finding that, I'll put it this way. We have the ingredients. We just got to find the right recipe that the inconveniences aren't also disruptions.
Yes, so thank you. And we're hearing from parents that they support the testing in the schools from some of the participants in our audience. So thank you for sharing that. I want to turn back to you, Dr. Wilson, to ask a question about routines in COVID. We know that routines for our young people have really been disrupted because of COVID. I can say that there's been lots of conversation, in fact, about our young people being developmentally stunted in a way because they've had to really shift into a much more isolated presence. And so one of the questions we have is, how can parents really try to ensure that their children's routines can be as normal as possible, even with the shutdowns? There's so many shutdowns right now in the schools. They go back, they go forth, they go to quarantine, they come back. And so it has the intention of trying to protect their health, but also the repercussions of potentially making kids feel more isolated. So what can parents do to try to help their children to stay engaged during this time of closures and shutdowns?
That's a very good question. And it's a difficult one too. It's because it really means finding a routine for yourself too. And it depends on the work that the parent does, if they're going to be there present during the time. If not, is there some kind of network that they can join, a support system with other parents, other teachers that may have examples of routines that they can do during the course of the time that they're with their child. And remember, everything is age specific. So there are tools that, and I can say from the mental health, not on the educator part, because I don't know exactly what tools have been used in that, but I have seen for therapists, when they're working with their children virtually, they have virtual tools, there are new apps that they can use. They have the student or the child still be engaged. For instance, they have a sandbox where they can still use different figures to explain how they're feeling, to draw a picture that way. And that's still a way of engaging. And it can also be virtually as in a group setting too. If you have other kids that are involved, and each of them can add to that particular sandbox in that case. But it depends on what type of networks or systems are out there for young kids to use. So the challenge for me of answering that is not really knowing what the day looks like and for the different age groups. And the challenge also is it really depends on the parent and if they're going to be at home with them or if they're at work. So if they're at work, it may be very challenging unless they have someone else there that's going to be able to monitor the child to give them that routine. But I will tell you that routines are the best, like you mentioned. And we've had people during the time when they're supposed to be on virtual class playing video games.
Yes.
So if you don't have anyone there to watch and monitor to make sure they're actually engaged in the lesson, you don't know if they're participating.
That happens in my own house, right? So I can tell you that, I've gotten information back from the teachers that your child was on the phone the entire time, or your child was playing Fortnite. So, that is something that even as an engaged parent and an educator myself, former school principal, I've had to jump in with my kids about some of that. And part of it is it's easy to get lost in the virtual world of virtual reality, video games. And so trying to strike a balance, and especially for working parents. So working parents have really borne the brunt of so much of this.
And our teachers. So you think about our teachers who are educators that are teaching their students, but then they also have their own children. To make sure that they're engaged.
Absolutely. We've strapped this recovery on the backs of our educators, and it's been a thankless job for so many of them. And we're so worried about, what's going to happen to this profession of education because of how it continues to evolve. We have a shortage of bus drivers, a shortage of cafeteria staff. We can't find subs. And so we're seeing that this is having an immense impact all over the profession. I did a presentation where I shared that there was a study from the National Association of Secondary School Principals from 2021 that showed that 45% of all principals are now thinking about retiring because the pandemic has really impacted their work. And so one of the things that we're really seeing in all of this is that we have asked our school principals to become contact tracers, as I said earlier, and epidemiologists. Those are not roles that we are training our school leaders for. And so we've trained them around crisis management. We've not trained them for pandemic management. And this pandemic continues to go on and on and on. And so what you're seeing is that we're now asking people to not only push through the pandemic fatigue, but push through the resilience of the pandemic fatigue, because they've had to have extended resilience against this pandemic. And that's affected their home lives. It's affected everyone. Everyone has been so affected by this. And, and so we're seeing so many struggle. The struggle is not just for our students. It's also for our educators. And I would encourage any educators who are watching this evening to create safe spaces to be able to download your concerns, your stressors, your indices of burnout, because you've got to be able to share that. Taking it home, putting it in your teacher bag at night and walking out the building with it is not going to be helpful. You've got to find a safe space, a safe community to engage this dialogue around how we're going to get through this. I am famous for saying we're building the plane while we're flying it. And it's really important right now for all educators to reach out to one another, to keep each other lifted up. I saw a few of my former students this afternoon, both who are in leadership positions in schools, and I encourage them to cancel the PD. We don't need any more PD. Pack your staff up and go bowling, go ice skating, take everybody for an ice cream cone. Right now, we need to connect. We have been looking at each other in these black boxes for 2 years, almost 2 years. And so we need to figure out how to stay connected as human beings. We were built to have relationship. We were built and created for touch and engagement. And so we've got to figure out how to do that. Schools are the places that foster that the most. That's why so many of us go into education, because of the relationship building that we do there. And we know that educators have an incredible impact on the future. So I just want to make sure that we're lifting up this profession right now. My colleagues at the School of Education and I have been having this conversation about how we can continue to support nascent educators, also our school leaders, because it's really important as we are working our way through this pandemic that we build these communities of support right now to get through this. So
100%, everything you just said, 100%. That support system makes such a big difference. And I can just give an example. During the pandemic with myself and my colleagues, we would have time when we would work together. We would call it like our writing group. We called it our swag, a sisters writing accountability group. And we would just get together, and that's when we would work. We would be able to stay focused, get our tasks done, but we also had a chance to vent and share how we were feeling and share what we were going through. And then the key is to check on one another.
yes,
Is to really, because even that strong person that seems like they have everything together, check on that person, because we don't know what they're going through, because we're also dealing with grief. We're dealing with bereavement, because we have people that are taking care of loved ones who have COVID. We have people who have passed away from COVID. And so dealing with that grief and then going back to having to work or going back to taking care of their children and making sure their children are in routine. So it's very overwhelming. So again, going back to having compassion and understand that this is new for us all. And we're all learning how to survive through this. And we'll make it through this, but it's a matter of us working together and supporting each other.
that's right. That's right. So my advice, just as an educator, is to listen to these professionals and also seek out your communities. Whether it be your physical community or your social emotional communities, if you belong to certain groups, there are lots of online groups, but maybe create a walking group. There's so many things. Physical activity right now is also really important to keep up. So I really would encourage, and districts are trying to do a lot to make sure that they are taking care of their staffs. And so I want to just kind of turn, as I'm looking at the time, Dr. G, the question around where we are in this pandemic. Give us a little bit of an update. We are seeing that the pandemic has really had different ebbs and flows and ups and downs. And so now Omicron seems to be receding a little bit. What can we expect from future variants? And how do you think that will this continue to be as disruptive in the schools as it has been so far? Or should we just, expect that the future variants will be less disruptive and it won't have as much of an impact as this has had for the past 2 years on our schools?
Love it. This is a great question. And I get excited about answering this because one of my favorite books reading in elementary, middle school were those Choose Your Own Adventure books. Love them.
I love those. Yes.
It's really where we are right now. As I've said, we have the science to end this. We have it. We know how to not catch it. We know how to not spread it. And we know how to keep it as a non-life-threatening disease. We have those tools right now, February 3rd, 2022. So if we want to end the pandemic. Again, it doesn't get COVID away. COVID won't disappear. We just transform it into a non-life-threatening disease. And we can strategically know when, potentially where to wear a face mask and not let it disrupt our lives. We can learn how to have minor inconveniences. I'll call them inconveniences right now until we just accept them socially, right? Seatbelts were seen as inconveniences until we're just like, yeah, I'm going to wear a seatbelt. Bike helmets were seen as inconveniences until we're all like, yes, it's part of riding a bike. You want to be safe. So if we get a good portion of the population vaccinated, let's start there. It means we train our immune system to remove the one factor that led to this pandemic, one of the key three ones. That was catching our immune systems off guard. So if we train it with a vaccine that doesn't give us the disease, it just gives us the memory. It makes our immune system smart. If we do that, then we put the pressure on the virus to stay mild. We do that. We control its destiny. So vaccines are one way we get out of this. And remember, vaccines have been the only medical intervention where they have resulted in removing an infection. And the antibiotic has never done that. And the antiviral has never done that. It's been only vaccines. We don't have polio, we don't have smallpox anymore around in the US because of that. So the vaccines are one of the things. And I say that so confidently because while it's incredibly effective, it's also incredibly safe. I mean, this is the safest thing that we've ever created in the 21st century in regards to causing life-threatening issues. They occur at the rarest of rare. So again, my heart will go out to anyone if they suffer a dire consequence, but it is so rare. So recognize that. And then two, it's, as I said earlier, how can you strategically wear the face mask and the testing when we need to? So all that said and done, one of the reasons we're seeing Omicron play out is because remember, Omicron had the genetic potential to be more of a easier to catch bug. And we also gave it that potential, right? We got together for the holidays. I mean, Mother Nature, if she's running a book, she wrote a darn good one. She came out with Omicron right before Thanksgiving, and lo and behold, we gather for Thanksgiving, gather for Christmas, we gather for other holidays, Hanukkah, Kwanzaa, and then New Year's. So yeah, we let it kind of get around. And so from that standpoint, those kind of occurrences aren't occurring as frequently. So we are seeing Omicron die off a little bit in that fashion. Where we go next, as I said, it is our venture to choose. So we could put the pressure on Mother Nature to say, no, just keep COVID as something mild. And yeah, I would say the pandemic ends this summer. If that's the case, we get enough people vaccinated, we get enough individuals complying with face masks when we have a massive surge and so forth. Right, it's taking steps in, and if we have to scale back, it's not a disruption. It's an inconvenience of throwing on a face mask and moving on with life. That's it.
All right.
Do that. I will say, I'll end with this, but not just here in Baltimore. We got to get them everywhere else. We got to get them into the, vaccine equity has to account for that. So if you want to learn more information, you can always email us and we'll connect. Sorry about that.
Well, you have heard it here first.
Yeah.
Our own Dr. G has predicted that the pandemic is going to be gone this summer. So we are going to, that's your crystal ball, and I am going to hold you to it. So everyone has heard that here first. We are going to look forward to this summer so that we can come back to Dr. G and we'll call him the Swami G. That'll be your new DJ name. So as we're starting to close this out, I'm looking at the time and there's still so many questions I'm trying to get through. One of the important ones, Dr. Wilson, that we have from a classroom teacher, I think is important to fill out, is this question about helping teachers to deal with the mental health needs of students in the classroom. How should teachers, when they see, because they're seeing this, my children are reporting seeing more fights at school, more negative interactions at school. The stressors are really spilling over into the classrooms. Classroom teachers are really trying to deal with these stressors, but they don't want to trigger anyone. What should classroom teachers, what should administrators do to help to bolster and support students with their mental health right now?
My opinion, I think it would be great if we could incorporate some type of mindfulness in the course of the day. So that is part of the day itself. So it's for everybody to be able to have that time when they can decompress, they can learn how to deep breathe, they can talk about how their body would change if they're feeling angry with that body, what that's going to mean to them if they're feeling scared. You go through the different emotions and have them understand how their body responds to that. how they may feel angry, they may tense up, their jaws may clench, all those different things, so that they can learn then how to de-escalate those things by learning how to deep breathe and how to loosen their muscles, to relax. Those are things that if you start to incorporate into the class and everybody practices it, then it can be something that you can talk about later when it does happen. So all those things take practice. In the midst of it, it is a matter of learning how to de-escalate situations. And I'm sure the teachers have learned that before in other situations. And I don't know how each school deals with the discipline in those times, but I want students or educators to understand that some of those responses may be dealing with emotions, obviously, is again, that some students don't know how to verbalize their anger. They don't know how to verbalize their sadness or depression. So it may come out in different ways, ways of getting attention, of ways of bullying, of ways of acting out in class, or being withdrawn. So not everybody is the one that's going to verbalize it. Some people may be withdrawn. And of course, you can look at how their appearance is. If their appearance is all of a sudden changing and shifting, and then you know that something is not quite like it used to be before. And so if you have an opportunity to talk to them, pull them to the side and talk to them, that would be great. But ideally, if you can incorporate it into the entire class and have that be a routine, I think that would be the first step.
Awesome. Thank you. Thank you, Dr. Wilson. So will be our final question for the evening. I know there's just a couple more that I'd love to ask, but I know we don't have that much time. So this question is about how the pandemic, this is a kinship care question. How has the pandemic affected older parents or grandparents who might be high risk in raising school-age grandchildren in their homes? Are there any research studies that you've seen or perhaps participated in? I'd like both of you to answer that question.
So this is a great question, one that I don't have a research perspective to provide, but more of a clinical experience. We're recognizing, before the pandemic, infections were the #1 cause of mortality in our older age group individuals. That's why so many vaccines, from pneumonia shots, et cetera, really get emphasized for that age group. COVID amplified that. And so what you saw was a lot of trying to juggle those situations. I saw it personally with my own parents caring for my kids, and I saw that with real world examples. And this is where I think the pandemic, if there's a silver lining, it needs to emphasize that we can't think in an ageist perspective to only get one benefit for one age group. It's got to transcend. So when people come to me about vaccinating kids, I'm like, yeah, look, you vaccinate them also to protect the elderly. One of the last comment, I'll turn over to Dr. Wilson. Dr. Anderson, remember we got this beautiful student, Watson, from Rocky Boy, Montana, for the Chickasaw tribe. And he came on and he made it clear he's here to help protect the elders, because history is passed on orally. If you lose them, you lose their history. And what I love about that is the relationships really got emphasized. Youth were all in to protect the elderly, and that's what I'm seeing now. You got to make that emphasis. So yeah, maybe some of the relationship changed, but I'm hoping a silver lining came out that you do everything possible to protect every human being, regardless of the age. And Dr. Wilson and your cat, I'm turning it over to you.
She had to make her appearance. She waited to the end when she made her appearance. I agree with everything that Dr. G said, and I would just also add that caregiver stress, a lot of times one of the things that we do is, and this is all of us, is that when we're taking care of other people, we don't have the opportunity to take care of ourselves. We become so busy, and then it can manifest itself not only physically, but also mentally. So the biggest key, just like I talked about the oxygen, is just really making sure that you do self-care. You're going for your appointments, you're checking on your mental health and your physical health, because in turn, it's going to help with everyone else.
Thank you. Well, everyone, this has been a fantastic hour of conversation with two of our faculty experts here at Johns Hopkins. I want to thank all of our audience members. We had incredible questions. Thank you so much for sharing your questions. We tried to get to as many as we can. If you have additional questions that you would like for us to answer, please email us at heatcore@jhu.edu, and we will get back to you with a response. So we want to thank you. For those of you who are in education, if you would like the Heat Core team to come out and do virtual presentations in your school, also please reach out to us at the same email address, heatcore@jhu.edu. We also encourage you to follow us on social media. You can follow the Johns Hopkins Heat Core on Instagram, on Twitter, and on Facebook. On Twitter, it's at JH Heat Core, one word. Please follow us there. You can also find Dr. Galiatsatos on social media. He's always showing us beautiful pictures of his mother's Greek desserts. And we also appreciate Dr. Wilson. She's also active on social media. I can be found at Impact Greater on Twitter. I am also on Instagram, but for gardening, so not very much insight there on Instagram. I want to encourage those of you who've participated in this evening's proceedings to please fill out the survey. The survey will allow the Heat Core team to look at future programming. We want to know what else you want to hear from us about. We want to bring up these programs into your schools to talk directly to your students. So we thank you all so much. Again, I want to give a special shout out to the Heat Core production team. We have an incredible team of people that helped us to prepare for this evening. Thank you for providing the content. I want to say a special thank you to the Johns Hopkins University and Medicine and the Johns Hopkins Health System. I'd also like to thank our partners at the many schools around the region who've helped to promote tonight's event, and to thank my colleagues at the School of Education who've joined us this evening. For all of you who are families and educators as well, thanks again. We are so delighted that we've been able to have this conversation. This won't be the last one. We're looking forward to having future conversations like this. So if you have topics or questions that you'd like us to come back and have another conversation about, please again, email us at heatcore@jhu.edu. So with that, I want to sign off. Again, my name is Annette Anderson, and I want to bid you a wonderful evening. And thank you all so much for participating in tonight's town hall. Thanks so much.